Welcome to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. In order to stay safe, protect ourselves and others during the COVID-19 pandemic, many of us have been staying home and avoiding excessive personal contact. While this helps to keep the virus from spreading, it can make many of us feel very isolated. One group that has been particularly affected by social isolation are the elderly. With us today to discuss is licensed social worker Anita Bissinger, who works in the Mayo Clinic Health System. Thanks for being with us today, Anita. We're so glad to have you here. You know, one of the things that has particularly struck me is the restrictions in long-term care facilities. And can you tell us a little about what kind of restrictions have these facilities been putting on visitor contact and interperson contact during COVID-19 that can affect our elderly loved ones?
I don't have a lot of direct contact with long-term care facilities, but I do know from speaking to them that they have been very innovative in some of the ways in which they are helping their loved ones be able to meet and gather through portals such as this with a Zoom meeting or those types of contacts while the weather was warmer, windows and things like that. But when we look at the elderly in the whole and things like that, some of the other fun things that I've heard them do is like body bingo down the hallway. And so that was a way of combining both PT and some fun where people could see each other just within the facility in a socially distanced way. So I think they've been really innovative and mindful of the fact that they need to.
I think that's really neat. I've seen several pictures in the news of people getting married outside their grandmother or their mother's window, for instance, and I thought that was so neat.
Well, and I just was going to kind of bring in just sort of kind of a basic understanding of just how many elderly and seniors we're looking at, because our population in the United States by 2050 is going to be 22% people who are 60 and older. And I know many people in that age range don't really consider themselves to be in that senior group because we live much healthier lives than we did in the past. But a third of those people are at risk of loneliness through a variety of reasons, whether it's the loss of a spouse or, just because they change and how they live their lifestyle, becoming snowbirds, losing community and as a way of also having some experiences with loneliness too.
We've talked quite a bit before on this program about the psychological ramifications and mental health ramifications that might be associated with COVID-19. And it sounds like loneliness might be the next epidemic there. Can you tell us how to help manage social isolation that comes from this pandemic?
Part of this is really kind of looking at how we're driven to be part of a group. And it really goes all the way back to our history of as we evolved and became the people who we became. We needed, as individuals, we didn't do so well. It wasn't until we kind of figured out, if we have a group of people who are hunting and gathering together, they can bring in more food. And if we have a bunch of people who are, gathering the seeds and things like that and stuff, we can bring in more food. But you also then had to have the protective members of that group because some people could be looking out for other dangers while others did their work. And it was that process of becoming a group that was very important. And loneliness is a warning sign. It is a way of letting us know that we need to connect with a group somehow. Because when we are connected, we have so many chemicals in our brain that start firing that become important to us. Oxytocin, for example, is one of those chemicals that it reduces our fear level is reduced when we're around people we know and stuff, but also too, it then helps to promote that danger sign that we have when we're around people we don't know. And the endorphins, for example, that come when we touch people and we're connected both physically, which is why we often enjoy dancing, for example. And the dopamine center is really a strong driver in our wanting to have companionship because it's our reward center. When we talk to somebody and we get to just even smiling back and forth can have a huge impact on how our dopamine levels rise in our brain. And so that warning sign of loneliness says, you got to do something. You've got to figure out a way to get connected. Now, through this whole COVID process, we've had some people who are like, this is no big deal. And I'm talking about our introverts here, where, they really thrive and their energy comes from having time alone. And it may be that extroverted group that is struggling more so. But even introverts and extroverts still need that connection. And that connection comes in a variety of ways within our community. We are typically connected intimately, with those people who are close to us, our 3 to 5, maybe intimate circle, which now may be known as our COVID bubble, of people there. Also, we're connected socially within just the relationships beyond that, which can happen through things like social media. However, social media itself is not a long-term solution to loneliness. In fact, it can drive it higher. And then we also have that sense of wanting to be in a collective, part of a community, whether that's the YMCA or the church group or the knitting circle, whatever that is. That loneliness works to fill all three of those little areas: our intimate, our relationship, and our collections. So how do we then become connected? How do we drive towards that? And a lot of that then becomes how we want to connect with people. A lot of people have really developed social bubbles that are like, okay, these are the rules. This is what we're following. If you want to be part of our bubble, this is what you need to do.
Anita, if we are worried about loneliness and isolation, what questions should we be asking our loved ones and our friends and even our coworkers to help sort this out?
Part of this is kind of recognizing the loneliness that we're experiencing, because sometimes for some people loneliness can be experienced even when they're with their loved ones, and that could sometimes be maybe more of a mental health concern, and then we might need to go to see a mental health provider, just to seek maybe some skills to learn on how to become connected when we are around people, because they might be too shy to step into the conversation. But when we look at talking to our friends and talking to our loved ones, it might be setting up a goal. What's our goal in communication? And it could be like, let's set 15 minutes aside each day where we're going to talk to somebody, whether it be the person in the house where we don't have any phones, no TV, no radio, just total one-on-one conversation, or if it's calling a grandchild or calling a friend, somehow that we are being very intentional in what we're doing. Don't fall under the guise of that, well, if I talk to this person while I'm doing the dishes, I'm going to, everything will be fine. This is something with the COVID process, we have to be very intentional about what we're doing.
So are there questions that we could ask ourselves or ask others to help sort out what type of loneliness they're feeling and what the best way is to address it?
Part of it is looking back on our own history. When do I feel the most fulfilled around people? Sometimes people don't realize they are an introvert or an extrovert. Maybe they don't realize, oh, when I'm with people, I get more energy, or when I'm with people, I get drained. And so it's kind of even exploring what type of personality that they have. The other questions to kind of ask themselves kind of reverts back to what I talked about before with the mental health. If they're always lonely and they've never really felt the sense of belonging, then we need to maybe look at that mental health side of it. Surprisingly so, that COVID-19 is allowing us to have that we may not have had before because we were so busy, is a chance to really get to know ourselves. And one of the ways to do this is by actually embracing that solitude. Because with the invention of so much technology, gone are the days where when we sat down at a restaurant table, for example, we waited. We waited for whoever to come. We had some time alone with our thoughts. Now we are bombarded by electronic menus and electronic phones and all of these things which take our mind rather than giving us some time to just be. This is one of the surprising things that's been really beneficial out of COVID is kind of finding ways to get to know yourself. This is one of the most important questions for us to be doing, is to ask ourselves, who am I? What is it that I want? Focusing in on your thoughts and your feelings then lets you kind of expand beyond that into What's my creativity? What is my understanding of how I interact with nature? What would it be to spend time in meditation or prayer or doing art or music or anything that gives you kind of a sense of peace and joy? The other thing when we do this kind of a process is that we can then start setting goals. Once we know who and what we really are and what we want, well, do I want to do some service work? Because that kind of gets us outside of our own circle and our own bubble a little bit. Could it be, calling the YMCA, say, hey, I'd like to call, be a pal with a child. And is there somebody on your list that I can call? Something that gives us a sense of purpose, helping anybody in any way. There are a number of people who are doing things like that, making phone calls, connecting with people. It doesn't always have to be in person.
We've been using a lot of Zoom, which I vastly prefer to all the telephone meetings we used to have at
Yes.
Mayo Clinic, because I can see my coworkers and I enjoy that. Now, a lot of people may not be familiar with technology. Some of our elderly friends and relatives may not have that capability or understand how to use it well. What else can we do to help them stay connected?
I'm a firm believer in like some animals. I mean, animals are one of those things that have a gift of just being there and loving, and they too like to have companionship. Sometimes we're socialized and we don't even realize we're socializing because we're so used to it being a part of our life. Like if you have Meals on Wheels, you forget, oh wait, this is a way that I am connected, and I'm connected within my community by having somebody come in. It could even be beneficial for some people if they just even have someone come in and maybe do some home health services as a way to connect and have somebody else inside their bubble. There's different ways in which we can do this process. You're right, technology doesn't always work for everybody, but that is one way that we can look at maybe including some people into the bubble on a regular basis.
I found that I've even been writing a few more cards than I usually do, just so some of my loved ones can get something in the mailbox.
I have never been good at that. I always admire people who do that. But yes, that is another wonderful way that people do that. And sometimes too, there's other things that we can utilize too. They have very simplified pieces of technology. There's like the grandparent pad, where it's just like big square buttons you push and check, where you can start a video conference, where you can, get onto some connective devices like that. Sometimes too, it could be just even a simple matter of having like a heavy blanket on you. Sometimes people will even use weighted blankets just to kind of have that sense of giving a hug, or even just hugging yourself. Just it's okay to do these kind of things to bring in some of your own endorphins.
Anita, the holidays are now looming. We're here in November. And I'm wondering, how can we explain to parents, grandparents, and others that we may not be able to gather together during the holidays as we typically would?
Well, one of the things that I have been stressing, not only with my patients, but even with my peers, is how important it is for us to take care of ourselves, treat ourselves with kindness, encourage ourselves with the fact that this will pass. This is a moment in time for us. And just having a lot of compassion for ourselves. It's okay to be sad. It's okay to miss those events. But if we can practice some of that self-compassion for ourselves and for others, that's going to even help to bring in a connection that we may not have had otherwise. Another way is to imagine, just maybe even do this sort of a meditative process where you're imagining saying to your friends, may you be safe and protected. May you be peaceful and well. And as you do this, that can be a way of connecting on maybe a different level than we're used to connecting with people, but by bringing in that kind of compassion and then turn that to yourself. I think we sometimes forget that that connection doesn't always have to happen with physical. It can happen with just a presence of being within our own place. Because as we think about somebody, we're connected with them. They may not know we're connected with them, but we are connected with them.
I have heard that called sending positive well wishes, among other things. And I have to say that it does make you feel really, really positive yourself when you are thinking positively about something and someone and sending them kind thoughts for the day. really makes you feel better too.
It does, and it's really interesting because there's so many ways in which we can be connected. They've done research where people looked at a stone building for 2 minutes, and then people looked outside, looked at nature for 2 minutes. And then somebody would walk by and accidentally spill pencils on the ground, and the people who looked at nature helped the person who spilled the pencils more so than the people who looked at a stone building. And so it does really make a big difference at what we fill our lives with. Maybe it's as simple as getting yourself a house plant and taking care of a house plant. It's a way of becoming connected with your universe.
Our thanks today to Mayo Clinic social worker Anita Bissinger for discussing loneliness and isolation related to COVID-19, and particularly as we're going into the holiday season.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on podcasts. Thanks for listening and be well.